Can you have mesothelioma without symptoms? The shocking answer is yes, and this is one of the most dangerous aspects of this disease. Mesothelioma grows silently in the body for months or even years before the affected victim begins to feel that something's wrong. By the time these symptoms appear, the cancer has often progressed to advanced stages. Today, I want to explain how mesothelioma exists in the body without symptoms, why this happens, and what it means for early detection. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade, and understanding the silent progression of this disease is critical to catching it as early as possible. Let's start with why mesothelioma can exist without causing symptoms. Mesothelioma develops in the mesothelium, which is the thin lining that's there around many organs. For pleural mesothelioma, that's the lining of the cavity that holds the lungs. For peritoneal mesothelioma, it's the lining of the abdominal cavity. These linings are very thin tissues, and early tumors can grow on them without significantly interfering with the body's functions. Think about how your lungs work. You have enormous lung capacity, much more than you use during normal breathing. Early mesothelioma tumors might cause slight thickening of the pleura or small amounts of fluid accumulation, but your lungs can compensate. You might be breathing at 95% of normal capacity instead of 100%, but you don't notice because you weren't using that extra 5% anyway. Similarly, early peritoneal mesothelioma can develop in the abdominal lining without causing obvious symptoms right away. Small tumors and minimal fluid accumulation might not cause pain or noticeable bloating in the earliest stages. This is fundamentally different from cancers that develop in solid organs. If you have a tumor growing in your lung tissue itself, it's likely to cause symptoms earlier because it's taking up space where functional lung tissue should be. But mesothelioma grows on the lining, not in the organ itself, so it can progress further before symptoms appear. Making things even more complicated is mesothelioma's latency period, which typically means that the disease doesn't develop until 20 to 50 years after asbestos exposure. During decades, you feel completely fine, but the asbestos fibers lodged in your tissue are causing damage, and that's happening at a cellular level that you can't feel. By the time the damage accumulates enough to become tumors and the tumors grow enough to cause symptoms, decades have passed. Now, I want to take a little break here for a second to ask you a favor. If you're finding the information in this video helpful, please hit the like and subscribe buttons. It really helps us get seen by more people. If you have questions you'd like answered or a topic you'd like covered in a future video, send me a note in the comments section. And make sure you watch this video until the end, because I'm going to give you information about accessing help and resources. So, when do symptoms finally appear? For most patients, symptoms start when one of two things happens. Either fluid accumulation becomes significant enough to cause noticeable breathing difficulty or abdominal swelling, or your tumors grow large enough to cause pain, restrict organ function, or press on the nerves. For pleural mesothelioma, the first symptom is typically shortness of breath. But here's the insidious part. This breathlessness, it often develops so gradually that patients don't recognize it as a new symptom. They may notice they're a little more winded climbing stairs than they used to be, but they attribute it to being out of shape or getting older. Over weeks and months, it gets progressively worse until it becomes undeniable that something is very wrong. The persistent dry cough that many mesothelioma patients develop also tend to start subtly. It might be occasional at first and easily dismissed as an allergy or a cold that won't quite go away. By the time patients seek medical attention for the cough, it's often been going on for months. Chest pain from pleural mesothelioma usually appears later in the disease's progression. Early tumors may not cause pain, but as they grow and they press more on the chest wall or irritate nerve endings, that's when pain develops, and it's often described as a dull ache that gradually intensifies. For peritoneal mesothelioma, symptoms are even more vague in the early stages. Mild bloating, slight digestive discomfort, feeling full more quickly when eating. These symptoms are so common and so easily attributed to other causes that patients rarely seek medical attention for them initially. It's usually only when abdominal swelling becomes really pronounced or pain develops that patients go to see a doctor. This is why mesothelioma typically goes undiagnosed until it reaches advanced stages. Most patients are diagnosed at stage 3 or 4 because symptoms don't drive them to seek medical care until the disease has progressed significantly. Early stage diagnoses at stage 1 or 2, they're relatively rare and they often happen by accident, like when mesothelioma is discovered after a routine chest x-ray or a CT scan that's been done for another reason. A patient may go to the emergency room after a fall and get a chest x-ray that shows pleural thickening, or someone gets a CT scan before surgery for an unrelated condition and the abnormalities are noted. These accidental early diagnoses often lead to better outcomes because the treatments are beginning before symptoms develop. Now, this raises an important question. Should people with significant asbestos exposure get screened regularly, even if they don't have symptoms? There is no standard screening program for mesothelioma the way there is for breast cancer or colon cancer. The disease is too rare to justify screening the general population. But for individuals with heavy occupational asbestos exposure, like shipyard workers, insulators, construction workers with decades of exposure, a periodic chest CT scan might be a good idea. Some specialists recommend that high-risk individuals consider getting a low-dose chest CT scan every year or two, starting around age 50 or 30 years after their exposure ended. This is a conversation for you to have with your doctor. You should weigh the benefits of the potential early detection against the costs, against radiation exposure risks, and the risk of false positives that might lead to unnecessary additional testing. The challenge is that even with regular screening, mesothelioma can develop between scans. A scan that looks normal this year doesn't guarantee you won't develop symptoms next year, but catching changes early, like seeing pleural thickening or small effusions before symptoms develop, may allow for earlier treatment. What should you do if you have a significant asbestos exposure history but no symptoms? First, make sure your doctor knows about it and document where you worked, what years, and what your exposure involved, and keep this information in your medical records so that it's handy. Second, be vigilant about any respiratory changes. Don't dismiss new breathlessness, a cough that develops and persists, or any chest discomfort just because you mostly feel fine. See your doctor promptly and remember to mention your asbestos exposure history. Third, if you develop any symptoms, don't tell yourself it's nothing and don't accept it's probably nothing from a medical professional unless proper investigation has been done. Insist on imaging studies. A CT scan, not just a chest x-ray. They're much more sensitive for detecting early pleural changes. Fourth, consider asking your doctor about whether periodic screening makes sense for you given your exposure level. This is especially worth discussing if you've had very heavy exposure, like working as an insulator or having spent years in Navy engine rooms. Fifth, maintain your overall health. This doesn't prevent mesothelioma, but being in good health means you'll be a better candidate for aggressive treatment if you are diagnosed. Don't smoke, maintain a healthy weight, exercise regularly, and manage any chronic conditions you have. For For patients who've been diagnosed with mesothelioma but who haven't developed symptoms yet, and yes, this happens with incidental findings on imaging, there's an important decision to make about treatment timing. Some oncologists, they recommend beginning treatment immediately, even without symptoms, because waiting until symptoms develop means waiting until the disease has progressed further. Others may recommend careful monitoring with frequent imaging and beginning treatment when changes are seen or symptoms develop. This is a conversation to have with a mesothelioma specialist. They're the ones that can evaluate your specific situation, the stage and location of your disease, your overall health, and your preferences about aggressive versus conservative approaches. The symptom-free period, when it exists, is both a blessing and a curse. It's a blessing because you feel well and can maintain your quality of life. But it's a curse because it often means diagnosis happens later, when treatment options are more limited and prognosis is worse. Can you have mesothelioma without symptoms? Absolutely. Early-stage mesothelioma generally causes no noticeable symptoms because tumors on the mesothelial lining can grow without significantly affecting organ function. Symptoms typically appear only after significant fluid accumulation or tumor growth. This is why people with asbestos exposure history need to be vigilant about any subtle changes and consider discussing screening with their doctors. Early detection, it saves lives by catching mesothelioma when more treatment options are available. For more information, visit mesothelioma.net and ask for our free guide. It'll give you a lot of helpful information about both legal and medical options. Or if you want to speak directly with a patient advocate, call 1-800-692-8608 or use the live chat feature that's on the website. Don't forget, you can let me know any questions you have or any topics you'd like answered in a future video. And as for me, I'll see you next time.